Welcome to Chapter 9, Behavioral Factors in Cardiovascular Disease. Your cardiovascular system has three components: the heart, the arteries, and the veins. We all know what the heart is, right? The big thing in the center of our chest. Our heart is essentially a muscle that contracts and relaxes to pump your blood throughout your body. What's the purpose of our blood flowing throughout our body? It's to distribute oxygen. So the oxygen that we breathe in, our heart pumping pushes our blood out through all our different structures and all our different tissues to deliver this oxygen to our structures. The blood then removes carbon dioxide and waste from these cells to bring it back to the heart to reoxygenate the blood. So we're constantly pushing our blood through the body to distribute oxygen and remove waste from all our different structures. Next, we have the arteries. The arteries are the branch-like structures through which the blood flows on its way to distribute this oxygen, right? So the arteries are the route that the blood takes out, away from the heart to distribute. The blood terminates in capillaries that connect arteries to our veins. Our veins are the structures that the blood flows through on its way back to the heart. After it's distributed oxygen, it then flows back in to get reoxygenated. As our heart pumps, it makes a slight twisting motion, right? It's natural contracting and relaxing. There's a bit of a twist. And for this reason, this natural movement of the heart causes damage with the heart in its connection to the arteries, right? So our coronary arteries that connect right to our heart, as our heart's twisting, this causes a little bit of damage there. There's two different ways that this damage can heal. The first is the formation of a little bit of scar tissue, which results in not too much problem for us. The second involves the formation of plaque, and these are deposits of cholesterol and other fat into these arteries. This plaque can calcify into a hard, bony substance that thickens the arterial walls. The formation of this plaque is called atherosclerosis. A related but different problem is arteriosclerosis, which is the loss of elasticity in the arteries. So these arteries that connect to the heart, because we're pushing blood through them so regularly, they need this elasticity, right? That they can kind of move and loosen and deal with the blood flowing through them. When our arteries lose elasticity, that makes it harder for them to deal with increases in blood volume. So if we're running and our heart starts beating faster, we start pumping blood faster, right? Our arteries need these elasticity to deal with it, and it becomes problematic if our arteries have hardened and we can't deal with this. Coronary artery disease refers to the damage to these arteries that occurs through these two processes, right? So my formation of plaque and my hardening of my arteries. This is going to be coronary artery disease. When we have problems with our coronary arteries, this can impact the blood flow to and from the heart, right? If our arteries are hardening, they're not enabling our blood flow, we're having problems there. This can actually cut off the flow of blood to the heart, right? This is going to be called coronary heart disease, which is any time that we have damage to our heart as a result of insufficient blood flow. The most common, well heard of form of coronary heart disease is going to be a myocardial infarction or a heart attack. So this just occurs when, because of these problems with the arteries, our heart doesn't get enough blood, which results in tissue death. The extent of this tissue death is going to depend on the extent of the cutoff of blood flow. So we can have heart attacks that result in a lot of damage, right? If we're cutting off the blood flow quite severely, this can result in severe damage or death. Or we can have a more minor heart attack that results in just very little bit of tissue death, very brief, if the blood is cut off for a shorter amount of time. The signs of a heart attack include weakness and dizziness, nausea, cold sweats, difficulty breathing, and a crushing or squeezing pain in the chest, arms, shoulders, and back. There's some other problems that can also result from these damage to our arteries, right? One is a stroke. So we just described how we can have blood flow cut off to the heart and how this causes damage to the heart. A stroke occurs when the damage to our arteries cuts off blood flow to the head and neck, right? So our blood that our heart is distributing through the body, it also flows up to your brain, which is another huge control center of the body. So when this damage cuts off the blood flow to the brain and we start to have a similar process with tissue death in the brain, this is what a stroke is. Another area for potential problem with our heart is blood pressure. So we talked about how our arteries need their elasticity as our blood flows through them, right? We're constantly pumping blood, and our arteries, they contract and expand in order to deal with this pressure. When we have our hardening of the arteries, right, they're not equipped to deal with the flow of blood, so this can become problematic. Our blood pressure, when you see a blood pressure measurement, it's typically going to be expressed by two numbers. The first number is our systolic pressure, and this is the pressure that's generated by our heart's contraction. The second number is the diastolic pressure, and this is the pressure experienced between contractions that's going to reflect the elasticity of the walls, right? How elastic the walls of your arteries are. Hypertension is chronically elevated blood pressure. So when these two numbers are higher than they're supposed to be, right? These two different types of pressures are continually elevated. And this is not just if our blood pressure goes up because we go on a run, right? Sometimes our blood pressure elevates through physical activity or because we're stressed out, but just when it's chronically too high. And this is going to be the single best predictor of both heart attack and stroke, right? So if we have chronically elevated blood pressure, this can be a signal of serious problems for our heart. Unfortunately, this blood pressure can kind of be a silent killer, right? We're not always aware if we have high blood pressure. If you're not measuring your blood pressure, there might not be any symptoms of this problem. Now we're going to talk about the changing rates of cardiovascular disease. If you look at this chart, we can see that the rate of deaths from cardiovascular disease has been declining since the 1960s and is actually lower than it was in the 1920s. So we talk about all these problems, these diseases of civilization and our cardiovascular disease, but our rate of death has actually been fairly regularly declining since the 1960s. And this has changed for two reasons. First, we have improved emergency coronary care. So people who have heart attacks, these strokes, right, issues that are caused by our heart, we have emergency care that can save their lives, right? We're better at treating these emergency problems. But second is the change in risk factors for cardiovascular disease. So we've seen with more publicity about how to prevent cardiovascular disease, we've seen that our rates are declining. So when we say that our risk factors, right, or our behaviors that relate to heart disease have changed and helped the decline in cardiovascular disease and cardiovascular deaths, what are we talking about? What does this actually mean? The first is smoking. When we say smoking and health problems, for most of us, the first thing that comes to mind is lung cancer, but smoking can actually be hugely problematic for your heart. Cigarette smoking is the leading behavioral risk factor for cardiovascular disease. So if you want to prevent heart attacks and heart problems, the number one thing you can do is not smoke or quit smoking. It's been shown that people who currently smoke are 3 times more likely to suffer a heart attack than people who never smoke. Right? So smoking is going to be a huge factor, greatly increase your chance of a heart attack. However, quitting smoking does reduce the risk of heart disease. Within 3 years, former smokers are only twice as likely to suffer a heart attack as those who never smoked. So if you're currently smoking, you're 3 times as likely, but if you quit and you remain a non-smoker for 3 years, this cuts it down to twice as likely as a non-smoker. However, someone who's ever smoked, right, who was once a smoker, quitting doesn't ever quite lower your risk to the level of someone who never smoked, but it does lower it pretty substantially and fairly quickly. Next, we have diet and physical activity. Obesity and diet have been linked to an increased risk for cardiovascular disease. So those who are obese have a higher risk of heart problems than those who fall into the healthy weight range. Some large-scale studies have indicated some particularly problematic dietary factors that can relate to heart disease. So studies have linked diets high in saturated fat, as well as those high in sodium or salt, to heart problems. There's also been research to show that diets that are high in fruits and vegetables predict a lower incidence of cardiovascular disease. And diets that have fish, right, or are high in fish, may also offer some protection. Physical activity seems to be, or has been shown to be, protective for developing cardiovascular disease as well. People who engage in more regular, moderate to vigorous physical activity have a lower risk of heart problems than those who are sedentary or don't engage in activity. We also have some psychosocial factors that relate. Education level and income. We talk about this with a lot of things in this class, but those who have a higher education level and higher income are at lower risk for heart attack. Why is this? Again, those who have high levels of education and high income really have access to the knowledge and the resources to prevent heart disease. So they have access to the information about what foods they need to eat. And they have the income that they can gain access to diets high in fruits and vegetables, even though they might be more expensive. Or they can have a gym membership in order to facilitate that physical activity. Social support in marriage have also been linked to cardiovascular disease. Studies confirm that a lack of social support is a risk factor for cardiovascular disease. It's been shown that loneliness during childhood and adolescence relate to cardiovascular disease, and that this risk can become even more pronounced as we age. There was a study that showed that stress at either home or work related to the progression of blockage of the coronary arteries. So, in looking at individuals who had cardiovascular disease, those who had adequate support both at home and at work had less progressive blockage than those who were dealing with stress and didn't have the support. It's also been shown that married people are at a decreased risk for cardiovascular health problems as compared to those who are not married. So, being in a marriage, especially when it's got a supportive marriage, right, that marriage can be a really great source of social support, is protective for heart problems. Lastly, we have hostility and anger. A lot of the research looking at hostility and anger in heart disease came from research looking at type A behavior. So you might remember from your intro class, people who fall into this type A behavior category tend to be very driven, competitive, very time urgent, and they tend to be quick to anger. So initially, this research linked this type A behavior pattern to heart disease, right, as a risk factor for heart disease, but the research was a little shaky. Sometimes this type A behavior pattern predicted it, and sometimes it didn't. So when they looked at the different components of type A behavior, they found that it's particularly the hostility component. So those who are very quick to anger were most likely to have cardiovascular disease, right? This hostility and anger is a predictor. Research on hostility and type A personality has shown that the expression of anger is a risk factor, right? So people who are very expressive tend to jump to anger quickly and express their anger in an outward way has been linked to cardiovascular disease. One mechanism that might be going on here, right, the way that this expression of anger relates to cardiovascular disease is through cardiovascular reactivity, which is the increase in blood pressure and heart rate due to frustration, right? So as you get angry, you're frustrated, you're yelling, right? Maybe you're in traffic and you're screaming and honking your horn, right? Your blood pressure is increasing, right? Your heart is pumping faster, and this can be a risk factor for this cardiovascular disease. Other studies, however, have shown that suppressing anger can be toxic as well and can also really have an impact on your heart. So you're angry, you're not honking your horn and yelling in traffic, but that anger where you kind of fester and stew, right, this is also problematic. So what can one do if you are a type A personality and you want to take care of your heart? The best medical advice is to learn to recognize anger and to express it calmly and rationally, right? To identify that you're angry and express it in a calm way, kind of cope with the anger, engage in relaxation that's going to lower the blood pressure, right? Kind of bring down the anger, bring down the increased heart rate, and have a positive impact on your heart.